Hello and welcome. Today we'll be discussing a condition affecting the urinary system called bladder neck obstruction. This occurs when the opening between the bladder and the urethra becomes blocked, hindering the normal flow of urine. Understanding this condition is vital for early detection and effective management. So what causes bladder neck obstruction? In men, the most common cause is an enlarged prostate, also known as benign prostatic hyperplasia or BPH. As the prostate grows, it can squeeze the urethra, leading to obstruction. Other potential causes include scar tissue formation after surgery or infection, bladder neck contracture, which is a narrowing of the bladder neck, and rarely bladder or prostate cancer. Neurological conditions affecting bladder control can also contribute. Let's delve into the pathophysiology. The obstruction at the bladder neck disrupts the normal voiding process. The bladder muscle, the detrusor, has to work harder to push urine through the narrowed opening. Over time, this increased workload can cause the bladder muscle to thicken, a condition called detrusor hypertrophy. This thickening can initially help maintain urinary flow, but eventually, the bladder becomes less effective at emptying completely. This leads to residual urine remaining in the bladder, increasing the risk of urinary tract infections, bladder stones, and even kidney damage if the backflow of urine puts pressure on the ureters and kidneys. While precise epidemiological data specific to bladder neck obstruction can be limited and often grouped with lower urinary tract symptoms, it's important to understand that it's a relatively common condition, particularly in older men due to the prevalence of BPH. The incidence increases with age. However, it's important to note that while BPH is the most common cause in men, bladder neck obstruction itself can occur in both men and women, albeit less frequently in women. The signs and symptoms of bladder neck obstruction can significantly impact quality of life. Common symptoms include difficulty starting urination, a weak or intermittent urine stream, straining to urinate, frequent urination, especially at night, also known as nocturia, a feeling of incomplete bladder emptying, and urgency, the sudden and compelling need to urinate. In severe cases, complete urinary retention may occur, requiring immediate medical attention. Diagnosing bladder neck obstruction involves a comprehensive evaluation. The doctor will typically begin with a thorough medical history and physical examination. Urine tests are conducted to rule out infection or other underlying conditions. A post-void residual urine measurement assesses how much urine remains in the bladder after urination. Uroflowmetry measures the speed and amount of urine flow. Cystoscopy, which involves inserting a thin, flexible tube with a camera into the bladder, allows direct visualization of the bladder neck and urethra. Imaging studies, such as ultrasound or CT scans, may be used to assess the prostate size or identify other potential cause of obstruction. Pressure flow studies may also be used to assess the contractility of the bladder muscle. While there aren't distinct types of bladder neck obstruction in the same way you might classify a disease, it's helpful to think about the causes as different contributing factors. For example, you can have bladder neck obstruction primarily due to BPH, or primarily due to scar tissue, or primarily due to bladder neck contracture. The underlying cause dictates the most appropriate treatment approach. Treatment for bladder neck obstruction aims to relieve symptoms and prevent complications. Management options range from conservative approaches to surgical interventions. Alpha blockers are medications that relax the muscles in the prostate and bladder neck, improving urine flow. 5-alpha reductase inhibitors can shrink the prostate gland over time. Minimally invasive procedures, such as transurethral incision of the prostate, a TUIP, or transural resection of the prostate, a TURP, can widen the urethra. In some cases, open surgery may be necessary to remove a large prostate or repair bladder neck contractures. Catheterization might be needed for urinary retention. Preventing bladder neck obstruction is challenging, especially when BPH is the underlying cause. However, maintaining a healthy lifestyle, including a balanced diet, regular exercise, and managing underlying conditions like diabetes and high blood pressure may help. Avoiding excessive fluid intake before bedtime can reduce nocturia. Regular check-ups with a healthcare provider are crucial for early detection and management of prostate-related issues. The prognosis for bladder neck obstruction is generally good with appropriate treatment. Early diagnosis and intervention can prevent serious complications such as urinary retention, recurrent UTIs, and kidney damage. Recent research focuses on developing less invasive surgical techniques and more targeted medications to improve outcomes and minimize side effects. Studies are also exploring the role of lifestyle modifications and alternative therapies in managing symptoms associated with BPH and other causes of bladder neck obstruction. The ongoing research offers hope for continued improvements in the diagnosis and the management of this condition.